I just got the new FitBeast Resistance Flex Bars, and this set is amazing. You don't have to be a tennis player to have elbow pain. When you're picking up a glass, when you're opening a door, heck, when you're getting a shirt out of the closet, that pain on the outside of the elbow, it's called lateral epicondylitis, but I want to explain a little more about it. There are two different conditions that affect the elbow. If you don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and I've been treating patients with elbow pain for more than a decade now. It could be tendonitis or tendinosis. Tendonitis is when you have active inflammation, when you first hurt the elbow. Maybe you decided you were going to paint the room, you're using a roller, and the next day you woke up and you can't even grab the steering wheel because of the lateral elbow pain. That would typically be a tendonitis, short-term acute pain with inflammation and swelling. The other option is tendinosis. Tendinosis is a long-term condition. Maybe you've had pain in the lateral elbow for months or even years. It's not inflamed. You take anti-inflammatory medication, it doesn't help. That's because there's no active inflammation there, you just have tissue damage. In both cases, whether it's tendonitis or tendinosis, we use an umbrella term called tendinopathy. And one of the best treatments for more than 20 years is using isometric exercise to relieve the acute pain and eccentric exercise to reorganize and strengthen the tissues of the tendon. These Flex Bars by FitBeast are among the best ways to do isometric or eccentric exercise to relieve elbow pain. What I love about this set is you get 4 Flex Bars for the price of just 1 from most major competitors. These things are amazing, and they come in 4 different resistance levels. You have 6 pounds, 10 pounds, 15 pounds, and 25 pounds of pressure. If you want to maximize that muscle burn and build your forearms, the 25 pound is for you. But if you have acute onset of elbow pain and you can't even pick up a cup of coffee, the 6 pounder is where you're going to start. Having the variable resistance is super important to an effective workout program. These are great for simple warm-ups. If you're getting ready to go play pickleball or tennis, this is going to get the forearms ready. But these aren't just great for tennis elbow. They're great for golfer's elbow or medial epicondylitis. These are great for carpal tunnel, for grip strength. These are great for shoulder stability exercises. In my physical therapy clinic, I do a ton of work with patients who have had a rotator cuff repair or a subacromial decompression. And once we want to build stability in that shoulder to get back to function, whether it be construction work or sport, these Flex Bars are the way to do it. All right, so now that I've shown you how effective these Flex Bars can be, let me show you a couple exercises that you could start using as soon as the set arrives. The 3 main exercises are going to be supination, pronation, and a rotation. So supination is when I go from palm down to palm up. And it's the supinator muscles that are rotating the hand, the wrist, and the forearm. To do that, you can go thumb underneath or thumb on top. And all you're going to do is you're going to flex the bar downward so that your pinkies are touching. I like to hold the bottom position for a 2-second count and then control the return to straight. This is the concentric, the isometric, and the eccentric parts of the motion. Concentric is contracting the muscle and shortening it. Isometric is holding it in this position. Eccentric is controlling it back to the beginning. That would be supination. Now pronation is just the opposite. It's turning the palm over. So to do the pronation exercise, I grab the bar in the palm up position. I bring my thumbs together, hold it for a 2-second count, and control it on the return. Concentric, isometric, eccentric. And then the twisting or the rotation element, I go in this position. So right now I've got thumb down on the top hand, thumb up on the bottom hand, and I'm twisting as I straighten both arms. And you can see how those ridges go from being aligned parallel to twisted. It's just like wringing out a dirty towel. But what we're going to do is we're going to repeat this. We're going to go from the concentric to the isometric back to the eccentric. And then once I finish in this position, I'm going to switch. So now I'm going my right arm on top, my left arm on bottom, and I'm rotating the opposite direction. If you talk about getting that muscle pump going, this by far is one of my favorite because it involves the grip, the wrist extension, along with the wrist flexion. So when you're ready to deal with that lateral elbow pain that just hasn't gone away, the medication didn't help, you don't want to do injections or surgery, I recommend you check out the FitBeast Flex Bar on TikTok Shop. I'm going to put the link down below this video. Go check it out. I think you'll be more than satisfied.